Most people think of the liver and the heart as two separate problems, two separate organs, two separate conversations with two different specialists. But here's what I've learned in over 20 years of treating patients. That assumption may be one of the most dangerous ones in medicine today. I'm Dr. Eleanor Hayes, an internal medicine physician, and what I'm about to share with you is something I wish more people over 65 understood before they ended up in my office with a problem that had been quietly building for years. Fatty liver disease, a condition where excess fat accumulates in the liver, now affects roughly 1 in 4 adults worldwide. And for decades, it was considered a silent condition. Uncomfortable, yes, worth watching perhaps, but not urgent, not dangerous. That view has changed dramatically in recent research. What scientists and clinicians are now understanding is that a liver under fat-related stress doesn't just suffer quietly on its own. It sends out a constant stream of inflammatory signals, hormonal disruptions, and metabolic changes that travel directly to the heart. Over time, those signals change the structure of the heart, stiffen the arteries, and raise the risk of serious cardiovascular events. And after 65, when both liver function and cardiovascular resilience are naturally declining, this connection becomes even more significant. Here's the central idea I want you to carry through this entire video. I call it the inflammatory pipeline. Think of it this way. A stressed, fat-laden liver is not just a local problem. It becomes a factory, quietly producing and releasing inflammatory molecules into the bloodstream. Those molecules travel through that pipeline directly to the heart and blood vessels. And the heart, receiving that constant signal day after day, year after year, begins to change in response. Every warning sign I'm going to share today connects back to that pipeline. Each one is a signal that something in that system is under strain. Let's go through them. Warning sign 1. Persistent fatigue that feels different from ordinary tiredness and comes with upper right discomfort. Most people over 65 expect to feel more tired than they did at 40. That expectation is reasonable. But there's a quality of fatigue associated with liver stress that is genuinely different, and learning to distinguish the two matters. When the liver is inflamed or accumulating fat, its ability to process nutrients, regulate blood sugar, and filter metabolic waste becomes compromised. The result is a kind of cellular energy deficit. The body's cells aren't being fed and cleared the way they should be. This shows up as a deep, persistent tiredness that isn't explained by activity level or sleep quality. What makes this sign more specific is when it comes paired with a dull, heavy, or achy sensation in the upper right side of the abdomen, just below the rib cage. The liver itself has no pain receptors, but when it becomes enlarged or inflamed, it stretches the capsule of tissue surrounding it, and that stretching can be felt as pressure or discomfort in that region. Many patients describe it as a heaviness after eating, or feeling full very quickly, or simply something that doesn't feel quite right on my right side. It's vague enough to dismiss, and most people do. Here's where the heart connection enters. Research published in major cardiology journals over the past decade shows that liver inflammation, even at moderate levels, independently raises the levels of inflammatory proteins circulating in the blood. These same proteins, particularly one called C-reactive protein, are well-established markers of cardiovascular risk. The liver isn't just struggling, it's actively signaling the heart to be on alert. If you experience persistent fatigue alongside upper right heaviness, that combination deserves more than a shrug. It deserves a conversation with your doctor and a set of liver function tests. Warning sign 2. A waistline that keeps expanding, even when your overall weight stays the same. Stay with me here, because this one surprises almost everyone when I explain the mechanism behind it. Most people measure their health by the number on the scale. If the scale isn't moving dramatically, they assume things are stable. But research consistently shows that where fat is stored matters far more than total body weight alone. And after 65, the body has a strong tendency to shift fat storage toward the abdominal region, specifically the visceral fat that surrounds the internal organs, including the liver. Visceral fat is metabolically active in a way that subcutaneous fat, the fat just under the skin, is not. It releases its own inflammatory signals. It contributes directly to fatty liver disease, and it feeds the inflammatory pipeline we discussed. Here's the pattern I see in practice. A patient comes in, weight roughly unchanged from last year, but their waistline has gradually crept outward. Their trousers fit differently. Their midsection feels firmer and more distended. They attribute it to bloating, digestion, or just getting older. What may actually be happening is a shift in fat distribution toward the liver and surrounding organs, even without dramatic weight gain. Studies suggest that even a modest increase in waist circumference, particularly above 35 inches for women and 40 inches for men, correlates with a significantly higher likelihood of fatty liver disease and the cardiovascular complications that follow. The inflammatory pipeline becomes more active as visceral fat increases. More fat around the liver means more inflammatory output. More inflammatory output means more stress on the arteries and the heart. The practical takeaway is simple. Track your waistline, not just your weight. Measure at the level of the navel, in the morning, without pulling the tape too tight. If that number is quietly rising, even half an inch at a time, it's worth discussing. Warning sign 3. Blood sugar that hovers just above normal, year after year. Here's what most doctors don't have time to fully explain during a routine visit. Many people over 65 have seen the words borderline or pre-diabetic on a lab report. Their doctor mentions it. They're told to watch their diet. And then, because it isn't called diabetes, because there's no medication prescribed, because nothing feels different, they move on. Year after year, the number sits just above the normal range. And year after year, the full implications of that pattern go unexplained. Here's the mechanism that matters. When blood sugar regulation begins to struggle, the liver is deeply involved. A healthy liver helps regulate blood sugar by storing excess glucose and releasing it when the body needs it. But a liver compromised by fat accumulation becomes insulin resistant, meaning it stops responding properly to insulin's signals. It begins releasing glucose into the bloodstream at the wrong times and in the wrong amounts. This creates a reinforcing cycle. Fatty liver contributes to poor blood sugar regulation. Poor blood sugar regulation generates more inflammation. More inflammation worsens both liver function and cardiovascular risk simultaneously. Research now strongly suggests that people with fatty liver disease and even mildly elevated blood sugar are at meaningfully higher risk for a specific type of heart change, one where the heart muscle itself becomes stiffer and less able to relax properly between beats. This condition, called diastolic dysfunction, often produces no symptoms for years, but it silently reduces the heart's efficiency and raises the risk of heart failure over time. The number on your lab report that says 5.8 or 6.1 for fasting blood sugar is not just a borderline inconvenience. In the context of expanding waistline and persistent fatigue, it may be a key piece of a larger picture. Ask your doctor what your trend has been over the last 3 years, not just the most recent number. Warning sign 4. Blood pressure that is increasingly difficult to control, despite medication. This is one I encounter regularly in practice, and it's one of the most underappreciated connections between the liver and the heart. Most people with high blood pressure assume it's a problem that lives entirely in the cardiovascular system. The heart pumping too hard, the arteries too stiff, the salt intake too high. And those factors are real. But what's increasingly clear in the research is that liver inflammation plays a direct role in blood pressure regulation as well. Here's the pathway. An inflamed, fat-stressed liver alters the production and clearance of several hormones and signaling molecules that influence blood vessel tone. It affects the renin-angiotensin system, the body's primary blood pressure regulation mechanism. It generates oxidative stress that directly damages the inner lining of blood vessels, making them stiffer and less responsive. The result is a pattern I've seen multiple times. A patient whose blood pressure was reasonably well controlled for years begins to require higher doses, additional medications, or both, without any obvious change in their diet or lifestyle. Their cardiologist adjusts the medications, but nobody has evaluated the liver. Research suggests that treating underlying fatty liver disease through diet, movement, and weight management can sometimes improve blood pressure control in ways that additional medication alone does not. The pipeline works in both directions. Reduce the liver's inflammatory output, and the cardiovascular system often responds. If your blood pressure has become harder to control in recent years, and your doctor hasn't mentioned liver health, that's a conversation worth starting. Warning sign 5. Elevated triglycerides alongside low HDL on a routine cholesterol panel. Here's the surprising insight I saved for this point, and it's one that changes how most people read their lab results. Most people focus on their total cholesterol number, or their LDL, often called bad cholesterol. Those numbers matter, but there is a specific pattern within the cholesterol panel that is one of the most consistent markers of fatty liver disease and cardiovascular risk combined. That pattern is high triglycerides paired with low HDL cholesterol. Here's what's happening. The liver produces triglycerides from excess carbohydrates and fats. A liver under metabolic stress tends to produce and release triglycerides in excess, flooding the bloodstream with them. At the same time, high triglycerides in the blood are associated with lower levels of HDL, the protective cholesterol that helps clear debris from artery walls. This combination, high triglycerides, low HDL, is a hallmark of what researchers call metabolic syndrome, which is closely linked to fatty liver disease. And studies show that this lipid pattern is independently associated with a higher risk of atherosclerosis, the gradual buildup of plaque inside the arteries, as well as heart attack and stroke. The reason I save this for last is because this pattern often sits quietly in a lab report for years. A doctor glances at it, notes it, perhaps makes a dietary recommendation, and moves on. But when this pattern appears alongside expanding waist circumference, creeping blood sugar, hard-to-control blood pressure, and persistent fatigue, it is not background noise. It is the inflammatory pipeline speaking clearly. In my 20-plus years of practice, the patients who fared best were the ones who learned to read their own lab trends, not just a single snapshot, but the direction things were moving over time. Here is the surprising closing insight I want to leave you with. Fatty liver disease is largely reversible, especially in its early and moderate stages. Unlike many conditions, this one responds meaningfully to lifestyle intervention. Research shows that a reduction of even 5 to 10% of body weight, sustained over time, can measurably reduce liver fat, lower inflammation, and improve cardiovascular markers. Not surgery, not a dramatic medical intervention, consistent, modest change. That means the 5 warning signs I described today are not sentences. They are signals. And signals caught early give you something powerful, the ability to respond. Here are 3 smart questions to bring to your next appointment. Can we check my liver health with an ultrasound or liver enzyme blood tests, given my cardiovascular risk factors? What does my triglyceride to HDL ratio look like, and has it changed over the past few years? Are there lifestyle changes specifically targeted at liver health that could help my blood pressure and cholesterol as well? These questions open a conversation that could change your trajectory. Let me close with this. Your liver and your heart are not separate stories. They are chapters in the same story, connected by biology, by inflammation, and by the choices made every single day. After 65, that connection becomes more important, not less. You now know what to look for. Persistent fatigue with upper right discomfort, a waistline quietly expanding, blood sugar hovering just above normal year after year, blood pressure getting harder to control, and a cholesterol pattern of high triglycerides with low HDL. None of these alone tells the full story, but together they paint a picture, and now you know how to read it. If this video helped you, please subscribe. Every week I share research-backed health insights you won't find in a 10-minute doctor's visit. Now I want to hear from you. Which of these 5 signs surprised you most? Have you ever had a doctor connect your liver to your heart? Drop it in the comments below. I read every single one. And if you have a question about anything we discussed today, leave it below. Each week I review your comments and discuss your real questions with specialist doctors. Your question could be answered in an upcoming video. One more thing, tell me what topic you want next. Diabetes, memory, thyroid, heart health? You decide. This community exists for you. Comment below. I'm listening. This video is for educational purposes only and does not replace advice from your personal physician.